Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India. As you know that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, my number is given in the description 9226810630. Only WhatsApp, please. Today, we are going to discuss a common symptom, very common. That means, I think in our general medical practice, out of the 10 patients, nearly 4 or 5 patients may have the complaint of vomiting. So this much 50-60% are having the loose motions and fever, vomiting and fever, vomiting plus loose motions. So this is very common complaint. But still, what I want to suggest, whether you take Ayurvedic, allopathic, homeopathic treatment, but the proper cause finding is very much essential. If we, of course, I agree that most of the times that vomiting in Ayurveda, it is called as a chardi. Chardi is a vomiting. And that is the main reason is amashay or the stomach part is a little bit having irritation, inflammation. And then because of that irritation, inflammation, sometimes acidity increases, hydrochloric acid increases, amla pitta or hyperacidity can cause this type of the vomiting. Many times there is indigestion, lot of heavy food, the capacity is not there, beyond capacity you eat, or you eat sometimes unusual, you are usually vegetarian and you eat non-vegetarian, then also you start, because of the non-habitual that particular thing, you start vomiting. Another important thing is going infections in your body because of the food contamination or the water contamination, and there may be either loose motion, either vomiting, or both. Whenever both is there, we are suspecting food poisoning, which is called as a gastroenteritis, inflammation of the stomach as well as inflammation of the intestine. So there are one to another, so many diseases are there, but mostly symptomatic treatment is given by the modern doctors while using injection perinorm, Reglan, injection perinorm, that is metoclopramide, to control the spasm and to control the brain center of vomiting. It is making a what you can say the nullifying that effect of irritation to the vomiting center in the brain, and automatically your vomiting gets stops. In Ayurveda also, we usually say that popcorn, dry popcorn, without any spices and salt, etc. The आम्ही मराठीत त्याला लाह्या असं म्हणतो, साळीच्या लाह्या in Marathi. So it may be prepared from the rice flakes, you can say. That simple keeping in the mouth and just choosing that can also reduce the feeling of the vomiting. Then also sometimes we use the charak tablet, vomit tab. That is also very common. But in this particular video, I'm going to tell you the detailed causes. If at all it is a chronic type of vomiting, what type of the investigations you must take, and the detailed Ayurvedic prescriptions for the vomiting. So let us start to discuss about chardi or vomiting problem. As usual, as you know, Dr. Deshpande's habit, he always marks on that particular portion to make a concentration of viewer. So common causes of acute vomiting within a days, within hours. Sir, since morning I have started vomiting. Sir, since last 2 days I am getting an intermittent vomiting. So that is acute. If I am getting vomiting problem for months together, for years together, then that is called as a chronic vomiting. Okay. So first, as I have mentioned, gastroenteritis because of the food poisoning. Oh my God, this is can be controlled very easily. But meningitis, not easy. Meningitis must admit the patient better way, because in the children, high fever, you can see like this fever, very, very, very high fever, severe headache, projectile vomiting, neck stiffness, and Babinski sign positive, that is a plantar, you get some clinical hammer, and then fanning of the toes, that is called, that is a diagnosis. Then you have to do the cerebrospinal fluid examination, you may need some MRI, CT scan, this and that, and intravenous antibiotics, intravenous some management. But meningitis vomiting is a serious, and you must able to diagnose the meningitis vomiting by seeing the high fever, severe bursting headache, vomiting. Remember this, and neck stiffness. The patient chin cannot be touched over zipisternum notch. So this is meningitis. Then hepatic or gallbladder disease, for example, the jaundice. Yes, in the jaundice also there is a, but basically there is a nausea is more. Then gallbladder, maybe gallstones are there. Appendicitis, this is one of the important appendicitis, inflammation of the appendix. But there are actually the triad. Three symptoms are more important. For example, the central localized umbilical pain, and which is getting transferred to the right iliac fossa. Are you getting my point? First pain will start around the umbilicus, central portion of the abdomen, and then it shifts to the right corner of the abdomen, that is right iliac fossa. There you will get a severe tenderness. There also may be high fever, maybe constipation. So all these symptoms, spasmodic pain, appendicitis is a really, really bad pain. You also can admit the patient, because anytime that appendix can burst, and burst, and if that toxins get mixed with the blood, my God, then peritonitis, then this and that complication. So better way, appendicitis should be referred to the surgeon or in the hospital. Worms, very casual. Roundworm, threadworm, tapeworm, whipworm, you have to treat. There is a hypopigmented patches on the cheeks and face. Then also sometimes itching around the anus. The patient may be anemic. The child is always crying. Then even the child is eating too much, but not getting the muscles and bones and development. So these all the things together can indicate there is a worm infestation, and stool examination is the best one. Then pregnancy, yes, first 3 months, hyperemesis gravidarum. So if there is amenorrhea and the urinary pregnancy test is confirmed, then the vomiting is definitely related with the pregnancy. Iatrogenic, that means with some medicines also, it can antibiotics, anti-inflammatories, rifampicin, anti-tubercular drugs, that all can cause the metallic taste in the mouth and also vomiting. Then gastritis due to the alcohol, bad food, or allergy to certain foods, acute surgical abdomen. This is very, very, very dangerous, my dear friends. Very dangerous. So acute surgical abdomen, this term is important. There is absolute constipation, number one, no stools, then vomiting, and severe tenderness. Tenderness, what is tenderness? When you touch to the abdominal wall, patient will not allow you, patient do not allow to touch by doctor's hand the abdomen. And when you do, doctor do the palpation, it's very, very hard abdomen, board-like rigidity, like this, where I'm sitting right now, table, board-like rigidity. Then immediately, if you do the X-ray, that is a gas under diaphragm, peculiar finding of the radiology, gas under diaphragm. Medical student, doctor, please write down. I'm sharing the knowledge and experience. Don't miss it. And this is very acute condition. You must admit the patient, because that patient may need surgery. First is obstruction in the intestine. Second, can you see this? Intussusception. One part of the colon is getting inside to the other part. So this is intussusception. Can you get it? Repeatedly telling you, intussusception. Then strangulation. See the action. Strangulation, twisting, strangulation. So all these conditions, teething, obstruction, intussusception, strangulation, bleeding, it creates the acute surgical abdomen, severe pain, unbearable pain. Okay. Then migraine. Okay. We can treat migraine, but history will be there. Some exposure to the sunlight, or after going to the movies and all these things. See, some mental stress may be there. Then mountain sickness, as you go up on the hill, like Himalaya and all this Sahyadris, trekking, oxygen level becomes low and the patient is restless. Hysteric vomiting, psychological part. Epilepsy is different, hysteria is different. So in hysteria, this can cause because of the mental stress. Then peritonitis, inflammation of peritoneum, that is the abdominal covering. Biliary or renal colic. Biliary is related with the gallstones, and renal is urinary stones. Because of spasmodic severe pain can give rise also another symptom like vomiting. And uremia, kidney problem. Urea is a waste product which is thrown out of the urine. If it is accumulated, urea is accumulated in the blood, that is called as a uremia. Simple test, you can do the urine test as well as the blood test. Urea and creatine levels are too high. Patient is known case of chronic pyelonephritis or nephrotic syndrome, acute glomerulonephritis, this and that. Now, cases of chronic vomiting since last many weeks, many months, or many years, peptic ulcer with pyloric obstruction. You know the peptic ulcer, like after acidity, after gastritis, that becomes ulcer. Intestinal obstruction due to abdominal TB, tuberculosis, especially ileocecal joint, TB meningitis, SOL, here, space occupying lesion, that is a brain tumor, etc. Then Meniere's syndrome related with the ear, internal ear, ringing in the ear, giddiness will be there. So these together, headache will be there, Meniere's syndrome can cause the vomiting. Cyclical or recurrent vomiting, that is like a idiopathic vomiting. Now what you can do the LFT to rule out the hepatitis. Liver function test, stool examination for worm infestation and ova, amoebiasis, giardiasis, roundworm, threadworm, hookworm, and tapeworm. Okay, urine for pregnancy test, plain X-ray abdomen for acute surgical abdomen, gas under diaphragm, CSF, cerebrospinal fluid examination from the spinal cord, vertebral column for meningitis, etc. CT scan for space occupying lesion like brain tumor. Now, what we can do? Rule out the cause and treat accordingly. Can you see my cursor? I will mark for you. Okay, so you can focus on this. What are the medicines that Ayurveda can give? Laghu Suta Shekhara, 2 tablets 3 times in a day. Kamadudha anti-pitta, because pitta is inflammation, irritation, that is reduced, 2 tablets 3 times in a day. Then Goraksha Chinsavaleh from Hari Parshuram Aushadhalay, pharmacy in Pune, from late Khadiwale Vaidya, 2 teaspoons 2 times in a day. Then another prescription, Suta Shekhar tablet, 2 times 3 times in a day. And Pravala Panchamrita, when there is indigestion, 2 tablets 3 times in a day. Regimen or Pathyapathya, barley water mixed with the puffed rice, Laja Mand, it is called as the Laja Mand in Sanskrit. For acute condition, Mayurapicha Mashi, 1/4 teaspoon with honey, half hourly chatan. Then Shankh Basma, 125 to 250 milligram, half hourly with lemon juice. Amruta Dhara from Hari Parshuram Aushadhalaya, pharmacy from Khadiwale Vaidya in Pune city, 4 to 5 drops with warm water. Vomiting, if it is because of the indigestion, you can give the fresh ginger, little ginger with salt for chewing purpose. Then ginger powder, half teaspoon with sugar candy, 1/4 teaspoon with ghee and warm water. Shankhavati tablet, 2 tablets 3 times in a day. Now, vomiting due to pregnancy, what you can do? Shatavari Kalpa, 2 teaspoon with milk. This is Galactacog, anti-pitta. This will increase the breast milk after delivery. Okay. Barley water, Pravavati, that is anti-pitta. Hari Parshuram Aushadhalaya, pharmacy in Pune city from Khadiwale Vaidya, right? 2 tablets 3 times in a day. Kamadudavati, Hari Parshuram Aushadhalaya, 2 tablets 3 times in a day. Laghu Suta Shekhara, 2 tablets 3 times in a day. So this is another prescription over here. Suta Shekhar, 2 tablets 3 times in a day with Samapitta. Then Shankhabhasma, also for the indigestion. Shankhabhasmavati, 2 tablets 3 times in a day. Vomiting due to the traveling. Laghu Suta Shekhar, 2 tablets half hour before traveling and 6 hourly after that. Travel on empty stomach. Symptomatic treatment with any cause, if vomiting is there, then Vanti Ridrasa, 250 milligram 3 times in a day with milk. Vomitab tablet from Charak Pharmaceutical. Syrup is also available and tablet is also available, 2 tablet 1 hourly. Then Mayura Chandrika Bhasma, Baidyanath Company, 500 milligram, 1 gram with honey or lemon juice. And Pathyapathya, definitely in any type of the vomiting, avoid the irritation of the stomach, avoid the spicy, hot, pungent food, avoid unnecessary water and liquid food, stay away from the direct sun. So my dear friend, this was the discussion with relation to the common problem in general medical practice, that is vomiting. My dear friends, please like, share and subscribe my YouTube channel, and I wish you all the best. Take care. See you in the next video. Thank you.